So I'm Dr. Urmi Shukla. I'm the head of Oncology Medical at MSD.
Amazing. Please, talk to us about the work that you do with triple-negative breast cancer in MSD.
Of course. So for us, it's really key that we're using science and data to really improve and save lives. And that for us is our mission, is our ethos. So in order to do that, we have to be looking at the data, right? So many of your speakers have already said how key data is when we're making decisions, and then part of that is obviously collaborating.
Absolutely.
So one of the things that we've done as a company is speak to individuals, healthcare professionals who treat breast cancer, and also patients who've had breast cancer. And that has really shown us that, that diagnosis of breast cancer itself is devastating. And then you've heard these amazing stories today, honestly, about triple-negative breast cancer in particular. And some of the things we were hearing from patients was, I looked on Instagram and there was a post about breast cancer, and one of the comments was, well, at least it's not triple-negative.
Yeah.
Right?
Yeah, 100%.
And that really got us to thinking, well, do we know enough? Are we really getting the right data here? So the data suggests that there's 8,000 cases of triple-negative breast cancer a year, making up around 15% of all breast cancer diagnoses. But when we talk to clinicians and patients, we're really asking ourselves, is this accurate? And Leanne, we've spoke about this before, that one of those aspects is how triple-negative breast cancer is recorded in the NHS. So what we know is that the tests are being done in order to diagnose women, but when it comes to ticking the boxes, it's often that the box for progesterone in particular, that box is not ticked.
Wow.
So when we go and look at the data, we're still not convinced that actually these are the right numbers. What does that mean?
Yeah.
That means we're not hearing these stories.
We're not, no.
That means that we're not hearing the voices, we're not getting the lived experience. So that was key for us at MSD. So part of the campaign that we've discussed before is I Count.
Yeah.
So this is about making sure that all voices count and are counted.
Why does this matter, particularly when it comes to triple-negative breast cancer?
So matters for triple-negative breast cancer. So first and foremost, we've really heard about the experience and the support, the advocacy. So part of this is, of course, ensuring that if the numbers are right, then we can, organisations like us can do a couple of things. So one of the main intentions of iCount is to really raise awareness with policymakers, to really help them understand that, look, we're not collecting the data as well as we could, which then has a knock-on impact on the services. We've mentioned a bit about inequalities, so not everyone is accessing the right kind of support from their health services. So that's where this kind of data, we can have those conversations to make sure that patients are getting what they need and the services are well funded and the numbers are right.
Yeah. You guys are really leading the way with this, because I don't think there's anyone else doing this, is there? It's not happening. I honestly don't. And for me, it's like, there's the triple-negative breast cancer. I see it all the time. I hear it from the States. I'm hearing it from, West Africa a lot. That actually black women are disproportionately affected by that. This is, for me, so important to capture over here. Why isn't it being done?
So you're absolutely right. So our data comes from international data, actually,
it really
which shows us that triple-negative in particular disproportionately impacts South Asian and black women and younger women. So you've heard cases,
younger women,
under 40. So that in itself, as we've, any cancer diagnosis, we know it's devastating, but there's something in particular that's, for patients diagnosed with triple-negative, there are other additional aspects. Yeah. And that, I have listened to your podcast, and I know that, again, having individuals looking after you, that represent you, that understand you, that know where you're coming from, that is really important. Key. Because it's a different cultural background. It's a different, maybe, questions that you have. Maybe you're too shy to ask or embarrassed to ask. You think nobody's going to understand your question and know how to support you. So, again, yes, that's why we need accurate data for the UK.
What other work is MSD doing when it comes to triple-negative breast cancer? Because it's quite broad, and I just think there are some amazing initiatives that you guys are doing, but not maybe everybody hears about them all the time. So
so one of the key things we do is talk to patients and talk to individuals looking after patients. Yeah. So for us, we can be very far away. Let's be honest, and we often don't have those, if we're not having those conversations, then we don't know how to support. And one of the key things for us, and it's a pleasure being here today, so thank you for having us here, because we were just discussing over the break that, you know, these are the stories that we often don't hear. So it's really important we're hearing these stories, really important to understand how we can collaborate with organisations such as yours to make sure that then we can have those conversations that we're allowed to have with policymakers, with healthcare professionals, with NHS organisations, to make sure that, you know, in this particular example that we're discussing today, the data is collected accurately.
I will say as well, like, one thing I've noticed with Black Women Rising is that particularly some of the ladies that have the triple negative breast cancer definitely feel like they're not being heard, and their voices are not being spoken of. And I know, like, recently we had somebody that passed away, and I know a couple of women congregated and were like quite fearful of what that means to them and their own diagnosis and stuff like that. Like, what could, you know, organisations such as yours be doing more to help, you know, these groups as well? Because, you know, I you know, working with you guys, you've helped us on a project and hopefully more projects in the future. What more could be done?
It's a really good question. I think for us, it's going to sound corny, but I'm going to say, because it's true. It's always about the patient.
Absolutely.
So fundamentally, we have to be able to, when we're having our internal discussions, we have to always ask ourselves, how is this benefiting a patient? And therefore, when we're having these conversations internally, fundamentally, it's about making sure we're talking to the right people, individuals such as yourself. We're sharing our plans with you, and you feel empowered to turn around and say, hey, this isn't going to be good for everyone. You know, you're not helping all of the individuals that you should be supporting. So those conversations are key for us, and we really, you know, value them immensely, because it means that we can help people.
Exactly.
Make sure we're doing the right thing.
Yeah, and I think that's one thing I've realised about you guys is how open you actually are, and also working with us even to do this, you know, to bring this podcast to life, which is absolutely incredible. We're so grateful to you to be able to allow us to use this to tell our stories and create a platform for more change, and have people like yourself come on board, you know, and talk about the work that's been doing, because we have to collaborate together, right? Absolutely. Collaboration is key. And I know that's very important for you guys, right? Collaborating with other organisations, patient-led organisations, and hearing the stories is so important to you guys. And we're thankful that you've, you know, reached out to us and want to hear what we're doing and also get involved.
Yeah. No, absolutely. And thank you for collaborating with us.
No, absolutely.
It's absolutely essential. And, you know, it's a pleasure to be here for us all.
Thank you.
Thank you.
Urmi, everybody. Thank you.